Good afternoon, everyone. To begin with my presentation, before that, I would like to show the fundus photo of a patient of a disc suspect. So by seeing this type of the fundus photo, we may go for visual field analysis. So here, the visual field analysis of the right eye showing the high positive error, and whereas the left eye perimetry shows a high false negative error. Then we might go for a OCT RNFL. The OCT RNFL shows that both the side it is normal. So from this, the thing that come to our mind that there might be something that affects the performance of the visual field. So here is my presentation, that is a study of anxiety in patients with perimetry in primary open-angle glaucoma undergoing automated perimetry. As you all know, glaucoma is a chronic progressive optic neuropathy characterized by structural and functional damage. The functional damage and the progression of the disease are best assessed using perimetry. The visual field assessment is also affected by the patient's psychological status. And the anxiety can reduce focus during the visual field assessment that could affect the accuracy of the test. So the goal of my study is to determine how anxiety impacts the visual field accuracy in primary open-angle glaucoma. So prospective observational study of 53 patients were taken up in a tertiary care hospital for a period of 12 months with patients with primary open-angle glaucoma after satisfying the inclusion and exclusion criteria. The tools that are required inform consent from the patient, MOCA questionnaires, state-trade anxiety inventory forms Y1 and Y2, and the Humphrey visual field analyzer, Carl Chase Meditech were taken. The patient with primary open-angle glaucoma above 40 years of age are included in this study, and the patient who has having the history of use of steroid in the last 6 months, those who are having history of trauma, ocular surgery, or visual acuity less than 6/60, having history of chronic uveitis, evidence of pseudoexfoliation, pigment dispersion, having hypermature intumescent cataract, and those are already having pre-existing anxiety disorders or depression and are on psychotropic medication are excluded from the study. After fulfilling the inclusion and exclusion criteria, the patient undergoes through the basic ocular examinations, and they had to, after that, they had to do the MOCA questionnaire form to rule out the anxiety disorders. Those who have scored above 26 out of 30, they were our final samples. And then they have to go through another questionnaire, which is STAI form Y2, which calculates the intertest anxiety. Immediately after completion of the test or in between the test, they have to undergo through another form, that is Y1 form, which measures the intertest anxiety. After completing the test, they do the post-test questionnaire, which describes the test as anxious, difficult, tiring, long, uncomfortable, or unpleasant. So after collection of the data, we undergo through the statistical analysis. In this, the statistical software IBM SPSS version 19 were used. The result showed that the patient who had undergone more number of the test has less pre-test and intertest anxiety. And intertest anxiety is 1.11 times higher than that of the pre-test anxiety with a p-value of 0.0001. And the reliability indices like the false positive, false negative, and the fixation losses were improved by performing the more number of the test. So in our study, we found that the intertest anxiety is 1.11 times higher than that of the pre-test anxiety, and patients who had undergone more number of perimetry had a significant lower pre-test and intertest anxiety than those who had not. Kalia Penumal, Suhasini, and Janani V.S. et al. Reported that automated perimetry induces anxiety, which may affect the test performance. The measured anxiety reduces as the patient gains familiarity with the test with experience. Shenton S. and Nathan M. Kerr et al. In their study stated that increased anxiety, pre-test anxiety may reduce the HVF test reliability. So to conclude, the automated perimetry induces anxiety, and this has an impact on the test reliability. Patients with considerable experiences of the test procedure are less anxious, showing the scope for improving the test reliability through decreased anxiety. The clinicians therefore should acknowledge this anxiety with the patient and make attempts to reduce it in order to improve the patient experience and test reliability. These are my references.